All right, raise your hand if you've heard this. You have to take Medicare at 65 or you will have a penalty for the rest of your life. If I had a nickel for every time I hear this, I'd have a lot of nickels. The problem is that it just isn't true. Sometimes. So let's talk about it. This is one of the biggest myths of Medicare. Just because you turn 65 and you now qualify for Medicare does not mean that you have to take Medicare. The big bad penalty is always the scary thing that is mentioned, but there are two huge reasons, and they're both kind of related, why people do not take Medicare at 65 and they don't have any sort of penalty. Now, before we get into those, there is one reason why you will automatically be enrolled into Medicare at 65, and that is if you are taking Social Security benefits before age 65. If this is the case, you will automatically be enrolled into Medicare. All right, if you're not taking Social Security benefits, there are those two reasons that I mentioned, and you would not need to take Medicare at 65 and you wouldn't be penalized. So the first reason is that you are currently working and you are covered by your company's health insurance plan. If this is the case, you don't have to go on Medicare. As long as you are working and you are covered by your company plan, you can work until you're 100 if you want, and you would never need to take Medicare, and you would never have a penalty either. Now, just because you can do something doesn't mean that you should do something. Employer insurance plans vary dramatically, and some employer plans are more expensive and they offer less coverage than what Medicare can offer. Luckily, this is a pretty straightforward math conversation where you can compare the costs and the coverages of your employer plan to the costs and coverages of Medicare. So you may want to stay, you may want to switch. But you can stay on your company plan past 65, and when you are ready to retire, let's say it's at 67, then you can move on to Medicare with no penalty. This is because loss of group coverage qualifies as what is called a special election period. You would have 63 days from when your coverage through work ends to get Medicare with no penalty. Now, if you know the day that you will retire and you're no longer going to have benefits through work, then just like our channel name suggests, we would recommend that you start the Medicare sign-up process 90 days before you need Medicare to start. All right, that's the first reason why people don't take Medicare at 65 and don't see a penalty. Now, the second reason is very similar. If your spouse is currently working and you have insurance, health insurance specifically, through your spouse's work insurance plan, then you don't need to go on Medicare at 65 and you will not see any penalties. Just like our earlier example, maybe you and your spouse are the same age and your spouse doesn't retire until 67, then you can stay on your spouse's plan until you both lose coverage through your spouse's work. The main reasons why people decide to stay on their company plan rather than go on Medicare is because they have very strong company plans that have stronger benefits at a lower cost than Medicare, or a health savings account. Now, you see, when you go on Medicare, neither you nor your employer can contribute to a health savings account, or HSA. If the math works out, those employer contributions could be a huge benefit and tip the scales in favor of staying on your plan rather than taking Medicare. So some people will decide to continue working, stay on their group plan, and contribute to their HSA until they retire. There are some really important rules around HSA contributions and Medicare that we cover in this video right up here. Now, we have a tool on 90daysfromretirement.com in the decision support section that is called Medicare Readiness, and it will help guide you through whether Medicare makes sense or you should stay on your employer plan. The link is in the description of this video. All right, I'm about to go over the 4 reasons why you do have to take Medicare at 65 or you will see a penalty. But before I do, the last thing to mention about your employer coverage is the size of your company matters. All of the above still applies regardless of group size. You won't get a penalty. However, if you work at a company with fewer than 20 employees, things change. You see, for employer group insurance plans that have fewer than 20 employees, so 19 and under, once somebody becomes eligible for Medicare, think 65 years old, the company insurance plan becomes the secondary payer and Medicare becomes the primary payer. What this means is that if you do not have Medicare at 65 and you visit the doctor and there is a claim or a bill that needs to be paid, it will be sent to the insurance company that handles your employer health insurance plan. The insurance company will see the bill, they will see that you are eligible for Medicare but you don't have it, and that insurance company will understand that they should now be the secondary payer. And that insurance company can refuse to pay any of the bill until Medicare pays first. Since you do not have Medicare in this example, that means that you could be responsible for 100% of the bill. This is standard practice for many insurance companies. Not all, there are a limited number that will still pay the bill, but many won't. So if you work for a company that has fewer than 20 employees, you'll likely want to take Medicare at 65. All right, now there are those 4 situations where you do have to take Medicare at 65 or you will get penalized. The penalties are Part B and Part D premium penalties. The Part B penalty is 10% added to your Part B premium for every year that you do not take Medicare when you should. The Part D penalty is 1% of the national Part D average premium added to your Part D premium for every month you decide to postpone. So let's say that you decided to delay Medicare for 2 years when you should have taken it based on the 4 reasons coming up. You would have a 20% Part B premium penalty. 2 years times 10%. And if you get a Part D plan later, you would have a 24% Part D penalty. 1% times 2 years, which is 24 months. These penalties stay with you the rest of your life because, now here are the 4 reasons, you did not take Medicare when you were eligible, and either you did not have health insurance, or you were on an individual health insurance plan through the marketplace, or you were on a COBRA insurance plan, or last, number 4, you were on a retiree health plan. If any of those apply to you, you need to go on Medicare at 65 or you will be subject to those penalties. So when you hear someone say you have to go on Medicare at 65 or you will be penalized, and you or your spouse are currently working and you're on your company insurance plan, you can laugh and say, Or if you're covered through one of the 4 ways that we mentioned where you do need to go on Medicare, you can say, you know what? You're right, I do need to get my Medicare started. Once you're ready for Medicare, please get started early. We always recommend starting 90 days before you need Medicare to begin. The process takes time and you don't want to be stuck without coverage. We also always recommend that you work with an agent. It doesn't cost you anything to work with an agent. If you have that person in your life, please use them. They will save you a lot of time and money and stress. If you don't have that person in your life, we are always happy to help. All right, that's it for this video. As always, I appreciate you and thank you for watching.